everyone. I'm Fahad, the orthopedic consultant specializing in regenerative therapies, and today we're going to be talking to you about Goldic injection therapy. So ideally I'm just going to run through the process and the procedure of how the Goldic therapy is done. So it comes in a box such as this. Once you open up the box, we have all the syringes outlined here. So these are your main ones initially for the first appointment for the blood taking. So there's 4 of these. We have got a needle system for taking the blood as well, and a tap. We don't necessarily need to use the tap all the time, but the needle system should be sufficient. And we just connect the syringes onto the needle, butterfly needle, to take the blood. And the second process, which we will discuss later on, uses the Serum application system syringes. Thank you.
Things to remember. Use 4 BTS syringes and 4 Serum application system for 1 joint available in 1 Goldic kit. In case of 2 joints, use 8 BTS syringes with 8 Serum application system, which uses 2 Goldic kits. Day 1 of Goldic treatment includes blood draw, BTS syringe preparation and 24 hours incubation. The team performing the therapy must scrub well and ensure to perform a sterile therapy at all times. Open a new sterile pack onto a surgery table with the contents of the kit laid on the non-sterile side of the table. Now start by preparing the blood draw site using an alcohol swab. With the help of a nurse, open the BTS syringes ready for use. The consultant should use each BTS syringe by uncapping and screwing it onto the butterfly needle before drawing blood from the patient's arm. Consultant tip: you must choose a good vein to draw enough blood to fill all syringes. In case you do not get enough blood, use another vein. Insert the butterfly needle into the desired vein and start drawing blood. Using the plunger, ensure a steady flow is achieved to fill desired number of tubes. The nurse must be prepared with the next BTS syringe to be passed on to the consultant. Once the BTS syringe is filled, unscrew it carefully and attach an empty BTS syringe to continue drawing blood. Cap the filled syringe and place it in a safe position on the table. Invert the capped syringe upside down for about 5 to 10 times. Fill all the BTS syringe required for each joint. Snap the plunger off and store them for later use. Ensure the incubator is preset to 37 degrees Celsius. Recheck the temperature before storing the syringes and place the labeled syringes inside the incubator for 24 hours. The gold particles induce cytokines that are released into the serum, working overnight to obtain enough cytokines with each sample. Requirements for day 2 of Goldic therapy: injection needles and some plasters based on the number of joints. 1 centrifuge at 4,000 revolutions per minute. SA systems which comes with the Goldic kit, either 4 or 8 per patient. Lure lock caps, and a -18 degrees Celsius fridge to store samples for future use. Start by removing the BTS syringe based on the label. Recheck if the details on the syringe match with the patient and place the syringes on the table to be centrifuged. Based on the number of joints, ensure you have the right number of syringes. There should be 4 syringes for 1 joint or 8 syringes for 2 joints. Using the plunger, release the air and cap the syringes. Ensure all the syringes are tightly sealed and ready to be centrifuged.
So we're at the centrifuge now, so we're using our World PRP centrifuge that we have here in-house. So it's set at 4,000 revs per minute and a time at 10 minutes. So this is the standard setting for the Goldic. So we get it opened and we've got 4 containers, so we're going to try and see if we can put 2 into each one of them. So we put it down facing straight up with the caps facing the top. And because this patient has bilateral knees, we are using 2 in each, otherwise normally we'd just use 1 in each. So same again, 2 for these. The important thing is make sure they're upright with the caps facing on the top for all of them. So what we're doing now, just to avoid a little bit of movement, we're just trying to stabilize the syringes, so we're just wrapping them around a glove and putting them back inside. Okay, so then we close it and start.
In the meanwhile, lay out all the SAS tubes onto the table, a plunger and some sterile Lua lock caps to seal the prepared syringes. Ensure there are the right number of tubes to go with every BTS syringe. Prepare labeled pouches to store other filtered syringes for future use. The label must have the name of the patient, date of freezing and time. Once the centrifugation is complete, carefully remove each bucket and check if the sample has been spun well without any spillage.
The cap. Okay guys, so we've got the syringe here that comes out of the centrifuge. We take off the top cap. I'm going to use this the same plunger that we took out from the first syringe. We put it at the bottom. Okay. And then I'm just trying to get rid of the air at the top of the syringe. So you've got to do a little bit of a firm pressure as this goes on top. So you're removing out the air right to the top. Right to the top. So you take it going all the way to the top. Okay, so then you leave the plunger out. Then you take this next syringe with a filter and you attach it on the top with a nice good firm push. So it's nice and tight. Then you use the same plunger again. And what you're trying to do now is trying to push the serum all the way into the other syringe. So, okay, so hold the syringe really tight with your hand and then you push the serum through. As you can see it coming through. There's a considerable amount of force I'm using, so you've got to make sure it's steady and it's persistent force that's going through as you push the serum all the way across. Okay, so that's fully there now. So then we flip this over again and then we undo this to get rid of this. Right. So we've got a sterile cap here that we're using, so we just open the back end of it, remove the cap out and then tighten it up. And this now is ready to be put into the freezer for storage for the second and third injections.
Place all the syringes in the patient's labeled pouch to avoid mix-ups. Store the pouch in a preset -18°C fridge until the next appointment. Sterilization preparation for injections. The consultant must scrub up before starting the injections and must use a fresh pair of sterile gloves for every patient. Start by cleaning the joint or joints using an aseptic technique. Push out any air and make sure to use the right needle for the injections. Attach the needle to the syringe and ensure you have one syringe prepared for each joint. You can either use ultrasound or inject it directly within the joint if comfortable. The injections must be removed from the freezer 3 to 7 days apart to be injected within the joints. Make sure there are a total of 4 injections per patient injected throughout the appointment. Thaw syringes 10 minutes before the patient arrives for future injections. Repeat the Goldic injections for 4 appointments for each patient. Record symptoms before and after completing the Goldic treatment.